Now, ladies and gentlemen, Honorable Minister, sir, would be joining us on the stage any moment now. Ladies and gentlemen, may I have your kind attention? All those walking in now are kindly requested to occupy their seats as soon as possible, and once again requesting for all mobile phones to be kept on to silent mode. Thank you. May I have your kind attention? Ladies and gentlemen, Honorable Minister Sir would be joining us any moment now. All those who are standing at the back are kindly requested to occupy the seats. We request everyone to kindly be seated. And may I once again request for all mobile phones to be kept on to silent mode. Thank you. Ladies and gentlemen, let's put our hands together to welcome Honorable Chief Guest Shri Jagat Prakash Nadda ji, Honorable Union Minister, Ministry of Health and Family Welfare and Ministry of Chemicals and Fertilizers, Government of India. A very, very warm welcome to the Honorable Minister. Also joining the Honorable Minister Sir on the stage, we welcome Ms. Bansuri Swaraj, Honorable Member of Parliament, Professor Vinod Kumar Paul, Member Niti Aayog, Government of India, Dr. Rajiv Behl, Secretary Department of Health Research and Director General ICMR, Ms. Punya Salila Srivastava, Secretary Health and Family Welfare, Ministry of Health and Family Welfare. We welcome Mr. Amit Agarwal, Secretary Department of Pharmaceuticals, and Srimati Anu Nagar, Joint Secretary Department of Health Research. Namaskar and good morning. Honorable Chief Guest, Shri Jagat Prakash Nadda ji, Honorable Union Minister, Ministry of Health and Family Welfare and Ministry of Chemicals and Fertilizers, Government of India. Guests of honor, Ms. Bansuri Swaraj, Honorable Member of Parliament, Professor Vinod Kumar Paul, Member Niti Aayog, Government of India. Esteemed dignitaries on the dais, Ms. Punya Salila Srivastava, Secretary Health and Family Welfare, Mr. Amit Agarwal, Secretary Department of Pharmaceuticals, Dr. Rajiv Behl, Secretary Department of Health Research and Director General, Indian Council of Medical Research, Srimati Anu Nagar, Joint Secretary, Department of Health Research. Special invitees, distinguished government representatives and policymakers, healthcare and medical professionals, researchers, academicians and think tanks, industry and technology leaders, representatives of international organizations and development partners, heads of academic institutions, eminent speakers, delegates, respected members of the press and media, ladies and gentlemen. A warm welcome to the inaugural session of the International Symposium on Health Technology Assessment, ISHTA 2025, on the theme Bridging Evidence to Policy Health Technology Assessment for Affordable Healthcare, which is being organized by Department of Health Research, Ministry of Health and Family Welfare, Government of India, in collaboration with World Health Organization, India Country Office and Center for Global Development. ISHTA 2025 is not just a symposium. It's a movement towards evidence-based healthcare policies that ensure affordable, innovative, and accessible healthcare for all. This symposium is a crucial step towards advancing health technology assessment as a key driver for affordable and accessible healthcare in India. Over the next 2 days, we will engage in insightful discussions on how HTA can bridge evidence with policy, ensuring that healthcare remains patient-centric, efficient, and cost-effective. The presence of policymakers, industry leaders, and experts will ensure that ISHTA 2025 serves as a collaborative platform for transforming health technology assessment into a tool for equitable and sustainable healthcare solutions. We are honored to have with us today Shri Jagat Prakash Nadda ji, Honorable Union Minister, Ministry of Health and Family Welfare, and Ministry of Chemicals and Fertilizers. A visionary leader in healthcare and governance, is known for his dynamic vision, strategic policy making, and transformative contribution to India's healthcare and pharmaceutical sectors. Under his dynamic leadership, India's public health initiatives have witnessed unprecedented growth, with key reforms in universal healthcare access, affordable medicines, and indigenous pharmaceutical production. He has played a pivotal role in strengthening India's health infrastructure, particularly in expanding Ayushman Bharat, National Digital Health Mission, and immunization programs. A dedicated statement with vast administrative experience, Sir has consistently worked towards making healthcare more affordable, accessible, and technology-driven, ensuring India's global leadership in health innovation and pharmaceutical self-reliance. We are honored to welcome our esteemed chief guest, along with distinguished guests and experts. And as is customary, we begin this prestigious symposium with the traditional lighting of the lamp, a symbol of knowledge, progress, and enlightenment. May I request Honorable Minister, Sir, and eminent dignitaries present on the dais to kindly do the honors of lighting the ceremonial lamp and formally inaugurating ISHTA 2025. And let's put our hands together as the symposium has been formally inaugurated by the Honorable Minister. And may this light guide our discussions towards meaningful insights and impactful policy changes in healthcare. Ladies and gentlemen, each wick being lit and passed from one to another symbolizes the sharing of knowledge. May I request for a group photograph, sir? We thank the Honorable Minister and our dignitaries for doing the honors of lighting the ceremonial lamp and formally inaugurating the symposium. And to set the stage for today's discussion, we invite Srimati Anu Nagar, Joint Secretary, Department of Health Research, to deliver the welcome address and share the remarkable journey of HTA-IN.
A very good morning to you all. Honorable Union Minister, Ministry of Health and Family Welfare, and Ministry of Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, Honorable Member of Parliament, Madam Bansuri Swaraj ji, respected Professor Vinod Paul, Member Niti Aayog, Dr. Rajiv Behel, Secretary DHR and DG ICMR, Ma'am Punya Salila Srivastava, Secretary DOHFW, Shri Amit Agrawal, Secretary Department of Pharma, Dr. Rodrigo, WHO Country Head, our guests from 18 countries, and esteemed guests and participants. It is my proud privilege to welcome you all to the International Symposium on Health Technology Assessment. It is a great honor to welcome our Union Minister to the symposium. Sir, we are grateful to you for your esteemed presence. It reinforces the significance of our collective mission for providing world-class, affordable healthcare to our citizens. Sir, your leadership, vision, and unwavering commitment continues to inspire all of us. We look forward to your valuable insights and guidance today. We also take this opportunity to welcome our guest of honor, Madam Bansuri Swaraj ji, Honorable Member of Parliament. Ma'am, we really value your esteemed presence here and also keenly look forward to your contribution in shaping the future of our country. We also welcome Professor Vinod Paul, Member Niti Aayog, also in his capacity as Chairman of the HTA Board. Sir has ably guided us through this journey. We also welcome Ma'am Punya Salil Srivastava, Secretary, Department of Health and Family Welfare. Ma'am has steadfastly reinforced evidence-based decision-making both in policy and action. We also gratefully acknowledge the presence and support of Shri Amit Agrawal, Secretary PAMA, and leadership provided to this department by Dr. Rajiv Behel, Secretary DHR and DG ICMR. Sir, health technology assessment in India has so far evaluated about 98 health interventions for their clinical and cost effectiveness. The recommendations of HTA have been used for evidence-informed decision-making, for pricing and procurement, and introduction of new health technologies, both in central and state health departments. Sir, it is our continued endeavor to partner and sensitize state governments on use of HTA, and we have many representatives from state governments, including the principal secretaries here. HTA branding of products has also increased the credibility of these products for their marketing, both inside and outside the country. Through this symposium, sir, we strive to showcase our successes and further strengthen our processes through cross-learnings and dialogues. In the end, I would again like to extend a very warm, hearty welcome to our Chief Guest, Honorable Minister, sir, and all the esteemed guests. I also wish all of you a very happy International Women's Day. Jai Hind.
Thank you very much indeed, ma'am, for your inspiring words and for highlighting the progress of HTA in India in strengthening the healthcare delivery. It is now our privilege to invite Dr. Rajiv Behel, Secretary, Department of Health Research and Director General ICMR, to kindly share his insights on an ecosystem for developing health technologies for affordable healthcare.
Honorable Minister of Health and Family Welfare, Chemical and Fertilizers, Shri J.P. Nadda ji, Honorable Member of Parliament, Bansuri Swaraj ji, respected Dr. V.K. Paul, Member Niti Aayog, Health Secretary Punya Salila Srivastava ji, Department of Pharmaceutical Secretary Amit Agrawal ji, my colleague Anu Nagar ji, all the esteemed dignitaries in the hall, ladies and gentlemen, it is indeed my pleasure to add my welcome to you all for this very important event and symposium. I would only like to say three things to begin with, that the health technology assessment, as just was said by Anu Nagar ji, is not only now a program, but it is working in India to get affordable technologies evaluated, as you heard. But it is part of an ecosystem. It is part of an ecosystem that India has taken forward from its unprecedented response to the COVID-19 pandemic. As you all know, India not only managed, but managed extremely well the COVID pandemic with technologies that were developed within India. More than 95 crore tests of COVID were done in India with technologies that were indigenously developed and validated within the country. Similarly, we not only manufactured vaccines, but we made new vaccines in India, including the one that was ICMR assisted vaccine, ICMR developed vaccine with our industrial partners, which was Covaxin, which was given to more than 10 crore people in this country. So after that, a big change has happened in the country. The level of confidence that has been inspired by under the leadership of our most respected Honorable Prime Minister of India, Shri Narendra Modi ji, and under the guidance of our Honorable Health Minister Nadda ji, we have taken great confidence that India can develop indigenous, affordable, and first in the world technologies, not only the technologies that are less expensive, but also innovative technologies. For those of you who have been outside in the exhibition, would see examples of that at least 2 or 3 of those technologies are probably nowhere else in the world. And this is the ecosystem that the Indian Council of Medical Research and the Department of Health Research, along with, of course, our partners in Department of Biotechnology, the Department of Scientific and Industrial Research, the Department of Health and Family Welfare, Department of Pharmaceuticals, are all together building this ecosystem, which will help us in getting these technologies to the people of India and to the people of the world. And in that, I place the HTA towards the far right of that, where it will be, once the technology is developed, what is its cost effectiveness vis-a-vis all the other technologies that are available. So to end with, I'd like to share with you that the Department of Health Research, in its plan for Viksit Bharat at 2047, in the first 5-year plan, our first goal is to develop affordable, indigenous health technologies which will be available to the country and to the rest of the world. And this includes not only the technologies that exist, but also frontier technologies such as gene therapy and cell therapy. So I see this symposium in that light, that HTA is a very important part of that ecosystem. Thank you very much for being here, and we look forward to hearing from our Honorable Minister and getting his guidance further. Thank you.
Thank you, sir, for your valuable insights on fostering an ecosystem that promotes innovation and accessibility in healthcare technologies. It is now my privilege to invite Mr. Amit Agarwal, Secretary Department of Pharmaceuticals, to address on strengthening affordable healthcare in India.
Thank you. Honorable Union Minister for Health and Family Welfare and Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, Honorable Member of Parliament, Masri ji, my distinguished colleagues on the dais and distinguished speakers, distinguished audience, and colleagues from states and other stakeholder organizations. It's a pleasure to speak at this event, which is bringing together all stakeholders, public as well as experts, and from across the spectrum. Since his technology assessment by now has been duly anchored in the system, and it is very opportune that we take stock of what can we collectively do together to make the best use of this entire assessment approach in everything that we do. Just to, as I was reflecting, we've been individually talk to each other all the time in various programs, and as one reflects, there's so many ways in which it helps. So if we talk about researchers, industry, startups, it can help them identify what research and innovation projects to pick, which are the ones that hold the maximum value ultimately. For those who need to take decisions on procurement or buying, starting from individuals and households to governments, to other organizations, and to hospitals, it can help them decide what to buy. For those who make investments in technology which helps generate future products, whether it is governments through their programs or corporates or VCs, it can help them to identify where value lies, and again where the future therefore would lie, and what needs to be invested on. In government programs and policies, where should investment be steered which would be the best use of public health money, and in public health communication and policy interventions, in prescribing habits of doctors. In everything, HTA has a huge role to play, and this works best if all stakeholders are on the same page and think together for a whole of government, whole of society, whole of nation approach. And this symposium offers precisely that opportunity. In particular, as the Secretary for the Department of Pharmaceuticals, which has the mandate to promote medical technology, medical devices, and pharmaceuticals drugs, basically this department works in manufacturing enablement. That's a steady state technology. Then we have a major program, and we spent a whole of last week on the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, PMBJP initiative for Jan Aushadhi Kendras, where we're making highly affordable not only medicines but products available. And an HTA-based training of doctors can affect prescribing habits, and public communication can help generate demand because HTA helps identify the right price point of what would be most efficacious for individuals and for treatment. And as doctors and consumers support demand, since PMBJP does it on a viability basis but extremely cheaply, the whole 15,000 going on to 25,000 network of JAKs can really pitch in and support that. Our department also, through the National Pharmaceutical Pricing Authority, is responsible for price regulation. And in that, there is already a provision that if there is innovation in a drug, while it is currently based on market-based pricing, that innovative drug can apply and seek a special price point. Now, today we do that on our own in the NPPA, but an HTA methodology can be very useful in evaluating what's the right price point. And in fact, it could perhaps work in the reverse also. If somebody has an innovative project which will require investment and effort, and if a price point is readily available through the HTA technology, they could give signal something, a willingness to go with a particular price point, thereby enabling investment and research in that direction. Similarly, the drug price control order under the National Pharmaceutical Pricing Policy includes provision for exceptional pricing decision. Again, if it comes informed by science, which is well established, decision making today, which goes through expert committees, etc., and maybe dilatory and uncertain, can become more predictable and thereby help promote innovation. And similarly, in NLEM, while drugs, the normal generic drugs are commoditized, but if there is innovation happening around them or medical device products, a subclassification of that, again coupled with a price point, if it comes from the expert sides, for which our department depends on the Health Ministry, both Department of Health and Family Welfare and Department of Health Research, ICMR, that would be hugely helpful for us. Finally, research and innovation. That's the game, that's the future. Treatments of the future, products of the future are going to look very different, and that is already happening in a big way. We have in that our own National Institutes of Pharmaceutical Education and Research. The research, this year we set up centers of excellence there, in each of them focused on certain areas. The selection of the projects which will be taken up in partnership with industry can be guided by HTA. And when the projects are evaluated and published, or even papers are published, incorporating an HTA element will add to the body of public knowledge and decision making, both in policy as well as in commercial decisions. And finally, we just yesterday launched the EOI, the Expressions of Interest, for our promotion of research and innovation in pharma medtech sector, PRIP scheme, where we are going to support both industry and startups directly to the tune of rupees 4,250 crores. And in that, we had already internally discussed with the HTA organization of the Department of Health Research, and some of the learning from that we try to factor in while evaluating proposals. And as proposals come out also, we would be guided by HTA methodology in helping evaluate them, showcase them, and that can also result in market matchmaking. So to end it all, I compliment the Department of Health Research for organizing this summit and for giving us all this opportunity to engage with you. Thank you.
Thank you, sir, for sharing your thoughts on how we can make affordable healthcare for all through innovation and policy interventions. And now, ladies and gentlemen, to discuss the affordability and accessibility of health technologies in India, we are honored to invite Ms. Punya Salila Srivastava, Secretary Health and Family Welfare, Ministry of Health and Family Welfare. Let's put our hands together to welcome her.
Good morning and namaskar to everybody. A very, very happy Women's Day to all of you. Honorable Union Minister for Health and Family Welfare, Shri Jagat Prakash Nadda ji, Sushri Basuri Swaraj ji, our Honorable Member of Parliament, Professor Vinod Kumar Paul, Member Niti Ayog, Dr. Rajiv Behel, our organizer for today, Amit Agarwal ji, Anu Nagar ji, distinguished guests, esteemed colleagues and fellow advocates for affordable care. At the outset, I would like to congratulate ICMR and their partners for organizing this symposium. Almost every day these days, we read heartening news about development of new technologies, new innovations by our enterprising youth, scientists, and entrepreneurs. And I think this symposium is indeed very timely. And it is indeed an honor and privilege to address all of you on this issue. As you are aware, under the visionary leadership of our Honorable Prime Minister and the guidance of our Honorable Health Minister, we have been working to ensure universal health coverage across the country. And one of the most pivotal steps in this direction has been deciding on the right interventions and integration of digital health technologies. In particular, digital health technologies, as you saw in the exhibition outside, or as you will see during the course of the day, have proven invaluable in bridging the gap in healthcare services between urban and rural areas. By using these technologies, we are improving the reach and quality of our healthcare services for all citizens, regardless of where they live. We are trying to strengthen and empower our primary health centers, our Ayushman Arogya Mandirs, our community health centers, our district hospitals by using these interventions. So what becomes very important is that we know what works and how to do it, at what price to do it, and what to prioritize. And it is in this context that HTA has proved invaluable to us. As we implement our various healthcare programs, it guides us in one, being evidence-based, in deciding what is safe, the cost effectiveness, and in supporting innovations. So what I would like to share at this stage with you is some of the digital initiatives that we have taken in the country. So whether it's programs such as telemedicines, electronic health records, AI-driven diagnostics, or other indigenous technology solutions, they have improved the efficiency as well as the accessibility of our healthcare services. And this has resulted in significant reductions in treatment costs, some of which has been shared in this exhibition with all of you. It has also helped us streamline our healthcare guidelines and benefit our public health programs and, most importantly, citizens. So one such initiative, which I'm sure many of you are aware, is the eSanjeevani, our telemedicine portal. It has revolutionized access to healthcare by enabling millions of people to consult their doctors and specialists remotely. And with the help of AI-based clinical decision support systems, physicians are assisted with differential diagnosis, which improves the accuracy of treatments and reduces the chances of medical errors. As of today, eSanjeevani has successfully facilitated 351 million teleconsultations, both direct and indirect, making healthcare accessible to millions of people right at their doorstep, especially in remote and underserved areas. The Ayushman Bharat Digital Mission has also played a pivotal role in providing easy access to medical records, which significantly improves patient care and follow-up. Under this mission, I'm happy to share that nearly 48 crore health records have been linked, creating a comprehensive database that ensures continuity of care across healthcare departments and helps citizens store their healthcare records over their lifetime. Under the tertiary care for cancer centers, we have implemented a hub and spoke model to provide cancer care across the country. This model connects district hospitals and medical colleges with central cancer care treatment centers, ensuring that patients receive high quality care regardless of their location. Some of you might have read this year's budget announcement. Under the National Health Mission, we are supporting this effort by establishing district daycare centers, which will act as sub-spokes for cancer diagnosis and treatment. Whether it be ABDM, whether it be Sanjeevani, many of the measures which the HTA has undertaken will help us strengthen the link between the district cancer care centers, the tertiary cancer care centers, and even Ayushman Arogya Mandir, where we are screening for cancer. The National Telemental Health Program, Telemanas, is further improving access to quality mental health care services across the country. As of 28th February 2025, the program has handled more than 19 lakh calls on this helpline, providing crucial mental health support to all those in need. The UWIN portal, which we developed by repurposing the CoWIN portal, it digitizes vaccination services for pregnant women and children and has made significant progress. So far, we have registered 8.97 crore beneficiaries, conducted 1.57 crore vaccination sessions, and administered 34.8 crore vaccine doses by using the UWIN portal. So in all of these interventions, HTA is playing a critical role, and I'm sharing these interventions with this August gathering in the hope that more interventions can come up which can support the endeavors that we have already taken. HTA has already rendered a lot yeoman service for our national health mission under the Pradhan Mantri Jan Arogya Yojana, as you will see in one of the exhibitors here. It has helped us devise, evaluate, and reduce the cost of our health benefit packages. So I really look forward to the outcome of this symposium, and I'm sure that the discussions today will catalyze in making our healthcare technologies truly accessible and affordable for every citizen. Thank you.
Thank you very much indeed, ma'am, for highlighting the critical role of accessibility in making healthcare truly inclusive. Ladies and gentlemen, we are honored to have with us Professor Vinod Kumar Paul, Member Niti Aayog, Government of India, a renowned public health expert and policymaker who has played a pivotal role in shaping India's healthcare landscape, spearheading transformative initiatives like Ayushman Bharat, National Health Policy, and Mission Indradhanush to enhance healthcare accessibility and affordability across the nation. We request Sir to kindly share his thoughts on strengthening India's health policy framework. Let's put our hands together to welcome our guest of honor.
Namaskar, good morning. Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, Madam Bansuri Swaraj ji, Honorable Member of Parliament, Dr. Rajiv Bahal, DGI SMR, Secretary DHR, Madam Punya Salila Srivastav ji, Secretary Ministry of Health and Family Welfare, Shri Amit Agarwal ji, Secretary Department of Pharmaceuticals, distinguished participants from 18 nations, WHO representative Dr. Afrin, other partners, colleagues and friends. It's a remarkable day today to celebrate the journey of an important, critical, pivotal institution in the health sector of India, namely the Health Technology Assessment India, which is playing an extremely important role in improving healthcare through providing information on effective strategies and technologies through the lens of cost effectiveness above all. ISHTA has evolved over the last 8 years into a very mature organization. And it is India's unique model of the institution. Over these years, and I've had the opportunity to be a part of the ISHTA family, I see 5 important achievements. Firstly, our organization has become robust thanks to the leadership of the 3 DGs, including Dr. Swami Swaminathan, Dr. Balram Bhargava, and of course Dr. Bahal, yourself. And the Government of India rightly decided to make ISHTA as a full-fledged office, attached office of the Department of Health Research. That's one achievement. We are robust in our organization, and our systems are working, the SOPs are in place. Second, the scientific rigor with which the analyses are being done are now profound and world-class. This took some time. We were into new areas. We value the inputs we received from other HTAs, in particular UK and Thailand, through WHO in particular. But as we evolved, our scientific rigor today is truly of global standards and embedded in the Indian context as it should be. Methodology, analysis, interpretations, linking it to cost effectiveness matrices that apply to our own nation. So that's the second achievement. The third achievement is that ISHTA is not about one particular office where 15 people are there in Delhi. No. It's about the entire network of our scientists, public health experts, our statisticians, our clinicians and others scattered all over the country. And that's our true strength. And we have a full-fledged network. You'll hear these details in the course of this symposium. That is our true strength. And now it's an emerging science. It's every day. The science of health technology assessment is now taking deep roots, and there is a huge capacity that is building up. And the fourth one, that we have seen its real use in health sector, health policy and health programs. Madam Shalila mentioned its role in Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. In fact, one of the big ticket levers that it allowed us to pull at the inception of Ayushman Bharat PMJ was the HTA inputs that came into the health benefit package, shall we say package rates. And ma'am has highlighted that over a period of time, we are gaining momentum in terms of our rigor, our real and appropriate costing to the packages. And this is our commitment to the partners who join the network of PMJ facilities, public and private, that the reimbursement that they get for serving should be optimally priced, not underpriced and not priced at the profiteering level. Finding that right balance has been a contribution of ISHTA, to which I must add the contributions that has been made to TB elimination program in particular, and also the very important curriculum of the country on sickle cell elimination, which was launched by the Honorable Prime Minister in 2023. So these are 3 major examples. And the 5th achievement is that in a federal system where health is a state subject, the uptake of these ideas, products, and partnership with the states has now started to bloom, which is so important because every state adds additional pathways of services, adapts the pathways that are generic in the nation, and indeed at times tries to do several new things in their own way, pushing the frontier further. And in that regard, therefore, acceptance by the states is extremely valuable. So these are the 5 achievements. But STA is about picking up the right things, right technologies, right strategy in preference to something which is less cost effective. It's a scientific process. We will never be in a world where everything can be done, every priority can be met, intrasectoral or across sectors. There will always be a need to rationalize resources. The richest of the nations are also rationalizing one versus the other. Having a scientific process to do so, based on evidence, based on analysis, based on intersectoral inputs, such as economic impact, social impact eventually, and so on, is the fabric, is the DNA of this institution. The nation has taken the call of the Honorable Prime Minister to lead this nation to the status of a Viksit nation, a developed nation, a Viksit Bharat at 2047. Viksit nations and emergent nations need strong institutions. And in that regard, sir, ISHTA is one of those institutions, sir, which will enable our path toward Viksit Bharat, playing its responsible role in one of the most important sectors of any nation, namely healthcare. The Honorable Prime Minister has said, only a Swasth Bharat can deliver a Viksit Bharat. Viksit Bharat is not by itself complete till we also have a healthy India. And in that regard, having an institution which on a daily basis is gaining strength is important, and we are very proud of the achievement. My congratulations to the team, ISHTA and Department of Health Research. I would urge that the teams that are representing the various parts of this network should really put in more energies, strengthen your capabilities. We are there to facilitate you. We want this science to evolve. I encourage you to pick up on PhD work in this area. I encourage you to write so that people globally notice our strength in this area. And one day, we will be the very best STA in the world. In 10 years from now, I have no doubt that we shall be the very best STA in the world, and that is a direction in which we will all move. We also potentially could have, sir, an international dimension, because India is a friend of the world, particularly the global south. I think time would come now, or may have already come, I would say, when we start thinking about this role for our nation, for our institution, which has now served the purpose for our nation, is serving the purpose of our nation continuously, to have an international outlook and international contribution that we all can make. In the presence of international experts in this area, we look forward to hearing your experiences, your expectations, your learnings, your best practices, so that we can embrace them into our own, very own health technology assessment system, organization, and the network that this nation has put together. Thank you very much. Jai Hind.
Thank you very much indeed, sir, for your insightful remarks and for emphasizing the need for a robust policy landscape for affordable healthcare. Ladies and gentlemen, we now move to a momentous segment of today's event, the release of some of the key initiatives. These initiatives mark significant strides in advancing healthcare accessibility, affordability, and innovation, strengthening our commitment to a healthier future for all. Each of these initiatives is a testament to India's dedication to evidence-based healthcare solutions and policy-driven advancements. The first initiative we unveil today is the ISHTA Technologies Compendium, which is a comprehensive document that showcases the latest health technology assessment studies conducted in India This compendium serves as a valuable resource for policymakers, researchers, and healthcare professionals, offering insights into cost effectiveness, affordability, and implementation strategies for innovative health technologies. I have the privilege now in requesting Honorable Chief Guest, Shri J.P. Nadda ji, Honorable Minister Sir, to officially release the HTA Technologies Compendium. And a round of applause on the release of HTA Technologies Compendium by the Honorable Minister. Thank you, sir. The next initiative that we unveil today is the Open Real-Time PCR Kit for Pulmonary Tuberculosis Diagnosis, QuantiPlus MTB Fast Detection Kit by Hon'ble Life Sciences. The Indian Council of Medical Research is committed to support the National Tuberculosis Elimination Program by developing and validating newer tools and interventions. One such test validated by ICMR is QuantiPlus MTB Fast Detection Kit, a low-cost indigenous open system RT-PCR test developed by Hon'ble Diagnostics.
आज का दिन हमारे लिए बहुत खास है क्योंकि हम मेडिकल इनोवेशंस पेटेंट मित्रा का भव्य शुभारंभ करने जा रहे हैं। यह आयोजन केवल एक समारोह नहीं बल्कि हमारे सपनों और प्रयासों की एक नई शुरुआत है। As we all know, the success of any great endeavor requires strong leadership and a dedicated team. With great pride and excitement, we are all set to unveil Medical Innovations Patent Mitra.
The Indian Council of Medical Research (ICMR) is India's apex body for biomedical research. Founded in 1911, ICMR operates autonomously under the Department of Health Research, Ministry of Health and Family Welfare. With a mission to advance medical innovations, ICMR transforms ideas into impactful products and processes for the public health system. However, many medical innovators face challenges in patent and technology transfer management. Limited awareness of patents, technology transfer, and lack of quality patent advisory support often hinders the translation of a patent to a product. To address these challenges, ICMR, in partnership with DOP, supported by DPIIT and under the guidance of Niti Aayog, has launched Medical Innovations Patent Mitra. This initiative provides comprehensive support for patent protection and technology transfer of medical innovations arising from ICMR institutes, ICMR extramural grantees and medical colleges and institutes across India. Innovators can register, submit applications for the requisite support to facilitate patentability assessments, patent filing, prosecution and maintenance, and transfer of their technologies for societal impact. This initiative shall position India as a global leader in biomedical innovation. Join our mission in empowering innovations that transform lives and revolutionize healthcare to achieve the goal of Viksit Bharat.
Thank you, sir.
Thank you very much indeed. And we thank the Honorable Minister, sir, for releasing all these key initiatives. And ladies and gentlemen, now is the moment we all have been waiting for, and it is our great honor to invite Shri Jagat Prakash Nadda ji, Honorable Union Minister, Ministry of Health and Family Welfare, and Ministry of Chemical and Fertilizers, Government of India, to kindly deliver the inaugural address. Let's put our hands together to welcome Honorable Minister, sir.
Professor V.K. Paulji, the member of Niti Aayog, Madam Basuri Swarajji, my colleague in the Parliament, Dr. Rajiv Bahalji, the Secretary, Department of Health Research and Director General of ICMR, Mrs. Punya Salila Srivastavji, the Secretary, Ministry of Health and Family Welfare, Shri Amit Agrawalji, the Secretary, Department of Pharmaceuticals, Madam Anu Nagarji, the Joint Secretary, Department of Health and Health Research, innovators, representative of industry, distinguished guests, friends from the print media and electronic media, ladies and gentlemen. First of all, I convey my heartfelt wishes and congratulations to all of you on the occasion of International Women's Day today. We can see on the dais also, a good representation is also there. I wish all of you a very happy International Day. It's a matter of pride to see women contributing in shaping policies and driving progress in all spheres. I can confidently say that in health sector, women are actively involved in a wide range of roles, from frontline workers like ASHAs and INAMs to key policy makers. I extend my appreciation and salute their dedication and impact in advancing the healthcare. Health is a priority for our government under the visionary leadership of Honorable Prime Minister Shri Narendra Modi ji. The Government of India is inclined to promote healthcare delivery, which is holistic, inclusive, preventive, promotive, curative, palliative, and rehabilitative. The preventive and the primary health care is being cared by a network of more than 175,000 Ayushman Arogya Mandirs under the National Health Mission. These Ayushman Arogya Mandirs provide comprehensive health care in the form of 12 packages of services, including free screening of non-communicable diseases like diabetes, hypertension, and 3 types of screening like cancer of oral cancer, breast cancer, and cervix cancer. Since 2014, there has been 101% of increase in the medical colleges. We have given a lot of emphasis to medical education. And I can say that 130% of increase has been there in the MBBS seats, 135% of increase is there in the postgraduate seats, and in a short span of a decade, we have now 22 All India Institute of Medical Sciences, a state of art. And we are trying to see that along with the doctors, we also have to see to expand our base, and the paramedics, staff nurse, frontline workers, we are giving training to them also and increasing their number in the same ratio. That is what we are trying to do. Here I would also like to say that to cater the secondary and the tertiary healthcare, we have done, as I said, about the 22 All Indians from Medical Sciences. We are now planning to create 75,000 seats in the next 5 years to come in the medical education. And in the last year, we have been able to enhance to the tune of 13,000. This year, we plan 10,000 more seats. And proposed in the coming times, we will be hitting the target of 75,000 additional seats in the medical education. If I talk about as Madam Salila talked about the universalization of health, Ayushman Bharat, the Pradhan Mantri Jan Arogya Yojana of Government of India, is the world's largest publicly funded health assurance scheme, which provides for secondary and tertiary hospitalization benefits up to rupees 500,000 per family per year, and 610 million beneficiaries, which is about 40% of the population of India. This is Ayushman Bharat. This PM Jan Arogya Yojana, along with the services provided under the NHM and other schemes of Government of India, have led to the decline of the out-of-pocket expenditure in a total expenditure of 64.2% I am confident that the deliberations and the discussions during the symposium will lead to an actionable insight that will benefit policy making and cost effectiveness in the healthcare. I once again wish the International Symposium a grand success, and thank you very much for giving me a patient hearing. Thank you.
A heartfelt thank you, sir, for your visionary leadership and for sharing a roadmap to make healthcare more affordable and accessible for all. And ladies and gentlemen, as we conclude this inaugural session, we extend our deepest gratitude to all esteemed dignitaries. And I would now like to invite Dr. Kavita Rajshekhar, Scientist F, Department of Health Research, to kindly say a few words of thanks.
Honorable dignitaries, esteemed guests and distinguished participants, as we conclude this remarkable inaugural session of International Symposium 2025, it is my privilege to extend a heartfelt vote of thanks to all those who have graced this occasion with their presence and insights. First and foremost, I would like to express our deepest gratitude to our Honorable Chief Guest, Shri Jagat Prakash Nadda ji, Honorable Union Minister of Health and Family Welfare, Ministry of Chemicals and Fertilizers, Government of India. Sir, under your visionary leadership and unwavering commitment to strengthening India's healthcare ecosystem, we are continued to be inspired for everything that we can do it for the healthcare sector. Thank you for sharing your valuable thoughts and your relentless efforts in making healthcare more accessible and affordable to every citizen of India. A special thanks to our guest of honor, Ms. Basuri Swaraj, Honorable Member of Parliament, for her esteemed presence and for supporting initiatives on innovations in healthcare. Our sincere appreciation to our guest of honor, Professor Vinod K. Paul, Member Niti Aayog, whose expertise and contribution in shaping India's health and technology landscape have been instrumental. Sir, your valuable insights into the role of HTA in evidence-based healthcare decisions has inspired us to climb this ladder of success. We are also deeply grateful to Ms. Punya Salila Srivastava, Secretary, Department of Health and Family Welfare, Ministry of Health and Family Welfare, for leadership in ensuring the accessibility and affordability of healthcare technologies reach every corner of the nation. A heartfelt thanks to you, sir, Mr. Amit Agarwal, Secretary, Department of Pharmaceuticals, for highlighting the crucial role of pharmaceuticals in affordable healthcare. Your insights into synergy between health technology and pharmaceutical innovations will surely guide us in creating sustainable solutions. Our sincere thanks to Dr. Rajiv Bell, Secretary, Department of Health and Family Welfare, DG ICMR. He always emphasizes on scientific advancements aligned with national priorities, which will strengthen the healthcare system. We also extend our warm gratitude to Srimati Anu Naga, Joint Secretary, Department of Health Research, for her unwavering efforts in advancing health technology assessment in India. Lastly, to all the central and state government officials, international and national delegates, international and national speakers, resource center scientists, academicians, media representatives, all organizing partners, WHO and CGD, your participation, expertise, and enthusiasm are what has made International Symposium a transformative platform. We look forward to engaging discussions and impactful outcomes in the sessions ahead. Thank you to all once again.
Thank you very much indeed. May I now request everyone to kindly rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
gentlemen, with this we conclude the inaugural session of ISHTA 2025. Thanking the Honorable Minister, sir, and all other distinguished dignitaries for sparing their valuable time and for guiding and motivating us. And ladies and gentlemen, the next 2 days promise enriching discussions, impactful insights, and collaborative actions towards shaping a future with health technology assessment. And we now invite